Hey everybody! So in this video, we're going to be talking about what medication can do, what it can't do, and whether or not there's medication for DID. You see, online and in person, we get this question a lot. Is there some sort of specific medication to help with DID specifically? And the answer is that there is not. DID is a coping mechanism for trauma. It's not something you can medicate away, and quite frankly, we wouldn't want to, because that would honestly make our lives a lot worse if we tried. But there are plenty of medications to help with the unpleasant symptoms of the other mental health conditions that can be comorbid with DID. Depression, anxiety, PTSD, all of these kinds of things, there are medications that can help. But one of the things that a lot of people also don't understand about psychiatric medication is, just like with medication for medical physical illnesses, it's not a magic cure-all. It's not some sort of quick fix that just you take it and suddenly you're all better and you never have a problem again. It's just like with a physical injury, it doesn't just magically get better because you medicate it. Well, mental health issues are psychological injuries that are either there because of environmental factors or genetic factors beyond your control. It's not something you can just fix. It's something that takes work. And medication for many can help. A lot of times, having therapy in conjunction with medication is very important, but medication can certainly provide relief from troublesome symptoms. Now, in the case of, say, antidepressants make depression more manageable. They don't make it go away. Because while the antidepressants can help balance the brain chemistry, they can't just completely erase ever feeling depressed. That's just not something that we currently have the knowledge to do. And anti-anxiety medications, same thing. They can make anxiety more manageable, but they can't make it so that you never feel anxious ever again. It's just not something that we can do at this time. And so essentially, what medication is it's a way to make it easier to function. It's a way to make the symptoms more manageable so that you can deal with them more easily. But it isn't a cure. It isn't going to just make you all better and you never have a problem ever again. It's just not like that. That's not how it works. Now, in regards to DID specifically, there is no medication for dissociation. It does not exist. There is no medication for having system members because, well, why would you want to try to medicate away having people who are there to help all of you function as a group? That would be rather silly. But we have heard that question on more than one occasion, is can you medicate them away? No, you can't medicate them away because they're their own separate people and they exist for a reason. They exist because your mind, when it was forming, needed everyone who currently exists in it to be there. And over time, if other traumas have occurred, your mind needed other people to be there. So everyone has a purpose, everyone exists for a reason. So attempting to medicate them away would be foolish because it would hurt you more than it would help you. Now, a lot of people also misunderstand the idea of medication in thinking that needing medication is somehow a weakness. And to those people, I will use this explanation. If a person had, say, cancer, would it be considered a weakness to take chemotherapy drugs so that they can live a more functional and healthy life? No, it would not. And the same thing is true for mental health stuff. Whether you're taking medication for depression, bipolar, schizophrenia, any psychiatric or mental health issue, it is not a weakness. It does not make you less of a person. It does not make you weak in any way, shape, or form, because you are medicating something that needs medicating. Not taking medication when you need it is like not setting a broken leg. It's not a good idea, and there is nothing wrong with needing help. And the idea that there is something wrong with it is a toxic mindset. It's not healthy. And anyone who ever tries to tell you that you shouldn't take your medication, don't listen to them. They don't know what they're talking about, and you don't need that kind of mentality in your life. Medication can make it easier to function. For some people, it can make it so that you can function at all. Some people, without their medication, they would be completely non-functional. And there is nothing wrong with needing that help. Now, medication also has side effects. So that is certainly something that you want to go over with your psychiatrist, your doctor, whoever it is who prescribes your medication. When you're first being prescribed, make sure you understand what all of the side effects are so that you can find the right medication for you. And also understand that finding the right medication is not instant. It can take time. It can take patience. It can take trying a few different things until you find the one that works. And that's because everyone's body is different. Everyone responds differently to medication. No two people are going to have exactly the same reaction. So it makes sense that it's going to take some time, some trial and error. Now, with DID, this can be a little bit more difficult. And OSDD as well, of course, because the way that your body responds can be very different depending on which system member is out. The best way to mitigate that problem, in our experience, is to have one specific system member who is always the one to take the medication, and that nobody else comes out until at least a half an hour after that medication has been taken. This helps to make sure that anybody who's more sensitive to it or would have a negative reaction to it does not do that, because nobody wants to be having a negative reaction to the medication that someone else in the system needs. So overall, if you are a DID or OSDD system, make sure that you negotiate as best as possible who takes the medication and when. Set reminders for yourself to remember, because with DID, forgetfulness is definitely a thing that happens a lot. Set reminders on your phone, keep notes. But if you need medication, make sure you have it, because running out is not good for you. And it's not a fun experience either. So, overall, medication is not a magic cure-all, but it is something that can help you when you need it, and there's nothing wrong with needing that help. And with DID, you just want to make sure, and as with OSDD as well, that you are taking your medication consistently, and that whoever is taking the medication does not have any negative reactions to it. Well, I hope you guys enjoyed this video. If you did, please like, subscribe, and don't forget to hit that notification bell. And let us know down in the comments if there's any other kinds of videos you'd like to see from us. Have a good day, everybody.